The mid-year budget debate also bringing out the huge strides made in the fight against COVID-19, with plans in the pipeline to build healthcare capacity and infrastructural works for Grand Bahama and the Family Islands. Cleopatra Murphy has the details coming out of the Health and Wellness Minister's budget contribution.
After 4 waves of the deadly COVID-19 pandemic, Minister of Health and Wellness, the Honourable Dr. Michael Darville, says he is optimistic the Bahamas is on the right course, and this particularly with the rate of new infections steadily low.
That on average, we have recorded a total of 4 cases per day, with an average positive rate of just 2%, well below the WHO benchmark of 5%. Sadly, this week, we recorded 2 deaths from COVID-19. However, the number of persons hospitalized remains relatively low at about 13 cases per week.
A declining infection rate has led to government relaxing some healthcare rules. Darville attributes that progress to free testing and free masks. Since pilot free testing began in October, more than 34,000 tests have been completed at just over $500,000.
During the first week in January, when we began the free testing and mass initiative in New Providence, we recorded 2,971 positive cases of COVID-19. By the 10th epi week of this year, which is around March the 7th, the number of recorded positive cases ceased and fall to about 21 cases.
As of March 9th, Darville says 40% of the population has been vaccinated, 332,549 vaccine doses administered, and that figure represents a little more than 50% of the eligible population. Despite progress, he says those 30 and below continue to have the lowest vaccination rate. Beyond COVID-19, the minister says he has been working to address critical deficiencies in the country's healthcare system.
The Cabinet of the Bahamas have approved the hiring of some 512 healthcare professionals to be deployed throughout the Bahamas to fill the many gaps that currently exist.
For the Family Islands, Darville also announced the government's plans to work with the IDB and to use a $5 million European Union grant to begin construction of 10 Family Islands clinics. Further, $29.5 million will go towards renovating 17 Family Island clinics.
We have to determine that the current emergency medical service system in our Family Islands need immediate upgrades. Family Islands, the days are about to go for putting our loved ones on the back of a truck and trying to push them to the airport, creating more damage than good.
The Minister of Health went on to reveal details of a new hospital on tap for Grand Bahama.
We are making steady progress and intend to break ground on this Northern Hospital at a new greenfield site. The former administration said it could not be done. But with partnership with the Beck Group, the Public Hospitals Authority, and the Ministry of Finance, we are seeking permits from the Grand Bahama Port Authority Technical Department prior to going into a brief RFP process and to award a contract to get shovel in the ground for this facility.
Darville says renovation of the male surgical ward at the Princess Margaret Hospital is also in the works, while government is working to launch the critical care phase of NHI. Cleopatra Murphy, ZNS Network News.
For as long as we've been a country, these islands have been a favorite for royalty. And for as long as the royals have adored us as a people, we've always been hospitable and gracious hosts. From a colony to a nation, now on the cusp of its golden anniversary, these shores have celebrated royal visits with class and dignity that is wholly Bahamian. As Her Majesty Queen Elizabeth celebrates her platinum anniversary on the throne, the islands of the Bahamas welcomes the Duke and Duchess of Cambridge on this, their first visit to the country. Our coverage starts Thursday, March 24th at 4 p.m. and continues through their departure Saturday, March 26th. The ZNS Network, your home for the royal visit. William and Kate.